Welcome to The Point, a podcast by Apex Benefits and dedicated to employee benefits thought leadership. You can find more episodes for free on iTunes by searching The Point or Apex Benefits. Please rate, review, and subscribe to be the first to know about what we have in store for you. To learn more about Apex Benefits, please visit our website at www.apexbg.com or find us on LinkedIn, Facebook, or Twitter. Let's get to the point together.
Welcome back to The Point. This is Scott Long, Executive Advisor with Apex Benefits, and on today's episode, I am joined by a couple colleagues, Stan Jackson, our Chief Innovation Officer, and Roger Greenawalt, our Health Informatics Actuary. Welcome to The Point, guys.
Thanks, Scott. Appreciate it.
Absolutely.
Thank you, Scott. Glad to be here.
Absolutely. I was looking forward to getting together today with so much going on. Things seem like they haven't necessarily slowed down in terms of the number of alerts that we're getting each day. But dating back to mid-April, it seemed like our inboxes were handling 200 to 300 COVID-related emails each day. So things seem like they have slowed down a little bit, but we're right in the thick of it. So I was really excited to get you guys both on the podcast today. So, hey, Stan, something I wanted to talk to you about was an article that you recently wrote for Apex. It was titled "Mitigate Future Financial Burden of COVID-19 Now," and you shared ideas on cost-cutting strategies that employers can put into action now that might help lessen future financial impact of COVID-19. There was something that really caught my attention, and it was and it relates really to the long-term idea and value of maintaining and improving an individual's health to prevent disease. Question I had for you is, how might preventive care change as a result of COVID-19?
Yeah, I think given all that we're starting to learn and the fact that we at Apex are very much a data-driven organization when it comes to helping people, manage health costs, as information has started to come out about those that have been most severely impacted by the illness, whether that's been lengthy hospital stays, being placed on a ventilator, or those who unfortunately perish as a result of the virus. What seems to be coming out of the data is that those with significant health conditions underlying also contracting the virus are where I think we're going to need to focus. We're probably going to see a down run in this thing over the summertime based on what people are telling us right now, but then it may be back with a vengeance come the fall. And certainly we need to be looking at those individuals that have diabetes. We need to be looking at those individuals that have existing heart conditions, and as well people with hypertension. And we need to figure out how best to serve those individuals in terms of making them healthier, finding ways to intervene with them, and if we do see a resurgence in this, finding a way to prevent the exposure of them to the virus, be that a work-at-home strategy, an isolation type of strategy, again, as we're undergoing, but at least to be able to continue business operations in the future.
Absolutely. So, one of the things that we've been talking, you and I have talked offline quite a bit, is just the delivery of care, right? And there is a disparity or a difference between more of the concierge approach of direct primary care versus primary care physicians. We've seen telemedicine and clinics have a spike in, certainly about making their services available, but specifically as it relates to the delivery of preventive care, how might COVID, influence the actual delivery, the delivery channel of preventive care?
Yeah, I think what we've seen, and maybe anecdotally, we'll have to look certainly into the data as it starts to tumble in, but I believe the telemedicine solution of calling a physician or calling a phone number and doing a video conversation like we're doing now seems to be very popular and be kind of gaining more acceptance, because for many people, it's the only way they've been able to access their physicians. A number of the hospital systems closed down access to both their specialty and primary care during this time. And the only alternative really has been to use those types of services, the telemedicine services. So definitely I see telemedicine gaining acceptance for those people that maybe were reluctant, but now have been forced to try it.
Yeah.
But they'll go, hey, this isn't so bad after all. As far as direct primary care, I think what we're going to see out of this is that ability to have a physician that you're able to tap into when you need them. And having that access is going to become very important. And I hope that people see the value of having that relationship already built before we get into or before they find themselves in a crisis.
Yeah, I think that's going to be extremely important. I appreciate that. So the other thing that caught my attention is, it kind of relates back to data, but your point was really well taken as I was reading the articles. Just that, of course, the relief legislation is going to really help, but actual claims experience ultimately will determine the facts, right? And it's specific to each plan. It's specific to location and so forth. So switching gears to potential impact to claims and what we might see in the near and in the long term. Raj, I'd love to get your thoughts here. What what I wanted to maybe throw out to you is just if you could walk us through likely near-term cost implications to employer-sponsored healthcare.
Yeah, sure. Basically, for the short term, most employers are going to see a reduction in their medical spend, because what we've seen is it's like all of the providers on one night. If you have something elective that you're talking about, on one night they close the door, they lock the door, and they set the key on the shelf. And so if you're talking about elective procedures, elective visits, they are not being dealt with right now. Hospital providers and other providers have stopped performing both inpatient and outpatient elective procedures. Outpatient visits have dropped by 60%. Non-emergency admissions have stopped. Many ER visits have stopped. Those that are true emergencies are still occurring, but all the others have stopped. A lot of laboratory testing has stopped because they were to support annual visits, healthcare visits, or upcoming elective surgeries. Urgent care and physician visits have been reduced significantly. Now, some of these have been offset by televisits, and televisits, as Stan suggested, has seen a great growth right now. And in addition to that, we have many older Americans that don't have access to computers or smartphones, and so just recently, Medicare has changed its systems so that those people can actually have contact with their physician and have a telephone visit, which is a move forward in order to service that population that don't have other access. But basically, the key thing is we have seen all of this cost suddenly be reduced. And so while it is a savings for the employers right now, the main thing to keep in mind is that many of these procedures are not canceled procedures. While some of them will not come back, a lot of these are just being postponed. And so if I'm an employer and I have a set budget that I'm setting aside, they should not be changing their budget right now. And if I'm an employer that I'm looking at my paid claims and I'm adjusting my reserve accordingly, what you need to be doing right now is, while the cost has gone down, you actually need to be increasing the reserve because those costs are going to be coming back. They are not costs that you have lost, but they are simply costs that are going to be postponed. And so they need to be strengthening their reserves in recognition of that.
Yeah, that's a great point. Obviously, a time to take prudent action and to strengthen reserve. So, thanks for covering the short term. What about the long term?
Well, and there is a difference between the short term and the long term, because the short term, I'm going to go back to my analogy of the provider just closed the door, locked the door, and that was basically overnight when everything got shut down. Now, as things open up, we're going to see them open up on a lot more gradual basis. Now, in Indiana, Governor Holcomb has indicated elective surgeries can begin on Monday, April 27th, next Monday. And so some laboratory testing in preparation for those surgeries has already started. But it's not going to bounce back nearly as quickly as it was shut down for two primary reasons. Number one, hospitals have only so much capacity, and so a lot of procedures have been put off, and they simply cannot flip the switch and take care of all those procedures at one time. They don't have the staffing to do so. But also, it's going to be slow coming back because these procedures are elective. People are going to be keeping in mind there is still a lot of COVID going on out there. The hospitals have a lot of COVID patients, and some people will move forward and say, I want my procedure done now. Others will be hesitant and want to let some of this die down further. And in particular, some of the elective surgeries are going to be among our older population. Our older population is our most at-risk population. And so and they will have a tendency to be slow to come back. And so for those reasons, while it was a cliff in terms of dropping off, it's going to be a slow ramp in terms of coming back up. And now, as to the employer cost, as I said, most of the elective procedures will be rescheduled. And so that is going to be cost where you set aside the money and you will need it because now those procedures are going to take place. There's a second category of cost. There are going to be those procedures that were needed, but things have gotten better. And so the person has determined, I no longer need that service. Maybe it was a physician visit. Maybe it was a minor elective procedure that has resolved itself in the meantime. And so that's going to be true bottom line savings, that those costs will never be paid. The third category is you have at-risk individuals that have been doing much more self-care than they had in the past simply because of lack of access. A number of those people, they will have had their health deteriorate, and so they're going to be coming back in a worse position, and so getting them back to a more stable position is going to be a higher cost than had they just held the status quo. And then the fourth sort of wild card here is a combination of the health situation, the COVID situation, and also the practicalities of a lot of people have lost their jobs through this. That adds to the mental anguish, and so we will see an uptick in the mental health providers that have been accessed and are being accessed. And so that's going to be a bump up that we see at this time. And so bottom line is, as things free up, the elective procedures will be performed, but the cost for this post-COVID bump will be higher than they would had things gone smoothly. And so that again reinforces the employers need to be setting aside reserves now, because those reserves will be tapped into and will be used later on for everything that was simply postponed.
That's a tremendous insight, Raj. Thank you. Hey, so we've talked a good amount about short-term and long-term. What I'd like to do when we come back on for our next episode, I would love to talk a little bit more about the aspect that we've heard so much about, is there's potential for additional waves. So when we come back on in a next episode, I'd love to get, Rod, your perspective on the actuarial perspective of the idea of waves, and Stan, would love to hear from you what you're hearing from the provider community. So I appreciate you guys joining us on The Point today.
Sure thing. Have a great weekend.
You can find more episodes for free on iTunes by searching The Point or Apex Benefits. Please rate, review, and subscribe to be the first to know about what we have in store for you. To learn more about Apex Benefits, please visit our website at www.apexbg.com or find us on LinkedIn, Facebook, or Twitter. Let's get to the point together.